Hi, I'm Jolinda Kelly.
And I'm Morgan Tracy, and we're the perinatal nurse navigators here at Wesley Medical Center. I've been a nurse here for nearly 13 years. I spent a few years in cardiac intensive care, then moved to labor and delivery in 2011. As an LDR nurse, I have the clinical experience needed to help you know what to expect along the way. I've also been where you are. All 4 of my children were born here at Wesley, including 1 C-section and 2 VBACs.
I've been a nurse here at Wesley for 18 years. My career began in the pediatric intensive care unit, and then I moved to the women's high-risk antepartum floor. I specialize in high-risk pregnancies, and I work closely with the high-risk OBs. I was one of the very first perinatal nurse navigators in the entire nation, which is why the work we do for our moms and babies is unmatched. Like Morgan, I've been where you are, having given birth to my children here at Wesley also.
Here at Wesley, we work with you and your doctor to customize your labor and delivery experience. Part of that includes where you give birth. We have 2 options. The Wesley Birth Care Suites is just north of the main hospital, yet is still connected through underground tunnels. It offers a low-risk, low-intervention delivery experience with all the safety and technology available in the main hospital. The Labor and Delivery Unit in Wesley Medical Center is reserved for our high-risk and/or preterm moms. We'll work with you and your doctor to determine what is right for you.
If you meet with our navigation team, that meeting will take place in our office, which is just inside the secured entrance to the women's hospital.
Part of our navigation process includes meeting with pre-admission testing nurses who make sure we have all of the necessary records up to date and ready for your delivery. If you're giving birth at the main hospital, you'll park inside the visitor parking garage on the corner of Hillside and Murdoch. On the green level, there are designated parking spots for women in labor. You can find them along the chain link fence that faces Hillside and along the wall opposite the entrance to the hospital. Once inside the hospital, you'll see our newly renovated secured women's entrance. We are very excited about the level of safety we offer our families. Everyone will need to check in at this desk before they are let through the secure doors. This desk is manned during visiting hours. If you come after visiting hours, there is a phone next to the door that you will pick up. It goes directly to our security team who will screen you and let you in. Once inside the secured entrance, you'll be in our newly renovated lobby. It's larger than before, allowing your visitors a comfortable space to wait until you are ready to see them. You will take these elevators up to the 2nd floor to get to our labor and delivery unit. This is where you will check in when you are here. There will be a couple of items to complete on arrival, but we try to keep this as minimal as possible. If you could have your driver's license and insurance card ready, that can make this process smoother. If you don't have either of those, please do not worry. We will still care for you. Our visitor policy for our labor and delivery unit is 2 people in the room at a time. They are allowed to switch out with others as needed. We will have a badge for each person in the room that will need to be given to the front desk before others will be allowed to enter the unit. When you come into labor and delivery for any reason other than a scheduled procedure, you will start in our triage hall. We have 6 private rooms where we can initially assess the situation and what is going on with you and your baby. If you're admitted from here, we will take you to a delivery room suite. Once you are 20 weeks gestation, we encourage you to come to labor and delivery with any pregnancy concerns such as bleeding, think your water is broken, contractions, or any other concern that you have that could affect your pregnancy. Once you are admitted as an inpatient, you will get settled in one of our state-of-the-art labor suites. Each of these suites has its own private bath and shower. This can be used during the labor process to help with comfort. Other labor support items we have are birthing balls, peanut balls, and squat bars. Our specialized beds also change into many different positions to help assist with labor and delivery. Our nursing staff has had education on spinning babies, which has to do with different positions to help aid in physiologic birth. Our goal for you is to have a smoother, faster labor process and therefore require less intervention. We love to work on birth plans to talk through all of these options as well as what to expect if baby doesn't allow for the perfect plan. We have refreshed our whole labor and delivery unit and are very excited about it. Here in labor and delivery, we have 3 operating rooms. One is specifically designed for our early high-risk deliveries as well as multiples. What this means for you is that should you have to have an emergent or urgent C-section, you will be cared for here in the same unit instead of having to travel through the hospital. All of our staff in labor and delivery operating rooms are specifically trained for C-sections and other emergent surgeries that could occur. Our birth care suites also has 2 operating rooms where they can perform C-sections as needed without transferring to the main hospital. As long as you and your baby transition okay after delivery, you should be able to stay at birth care suites. After delivery, no matter how you deliver, there is at least a 2 to 4 hour recovery time where we are watching you and baby very closely to make sure you both transition safely after delivery. During this time, your nurse will help you with latching and positioning for breastfeeding. If you prefer formula, we'd have that available as well. Please tell your nurse if there is anything related to feeding your baby that could trigger negative feelings. In labor and delivery, after this recovery time, or when you are stable, we will then move to either our postpartum floor or birth care suites for the rest of your stay. Our current visitor policy is to allow you to have time to meet and bond with your baby. After 4 hours, you can have up to 4 people in your room at a time. These visitors do need to check in at the front desk when they come and when they leave. Security is very important to us, and we use a state-of-the-art wireless security system in the women's building. We will discuss this security and other helpful tips while you are here with us. One of the ways we keep you and your baby safe, as well as anyone visiting, is to have every visitor sign in at the front desk. Please discuss this with your visitors, as this is important for everyone's safety. This is the room where you, your baby, and your main support person will be for the rest of your stay with us. Typical stays are 24 to 48 hours after a vaginal birth and 48 to 72 hours for those who have a C-section birth. This is the computer system in each room. It has the entertainment you can watch while you're here. Your phone for the room is also located here. Other services from the hospital may call you on this phone, such as food and nutrition, as well as birth registrar, to discuss your birth certificate. A lactation nurse will come see you during the daytime hours if you plan to breastfeed. Our audiology technicians will come visit during the first 24 hours after delivery to check baby's hearing. At 24 hours after delivery, your nurse will recheck baby's weight, as well as obtain blood work to check for jaundice. Depending on this result, this test may need to be repeated. If you desire to supplement your baby until your milk comes in, we have donor breast milk available upon request.
This is our high-risk Antepartum Unit. It is designed for our patients who are needing to be under close supervision during their pregnancy for conditions such as preterm labor, if your water breaks early, or if you're experiencing high blood pressures. This unit is a wonderful place to stay. You won't find a more versatile floor or group of nurses.
This is our neonatal intensive care unit, or NICU. It is located on the second floor with our labor and delivery unit. This is intentionally designed so that if your baby needs additional care or supervision, it's close by. Our NICU is a level 3 and the highest level of care in the region. We get many high-risk transports from all over Kansas and neighboring states because of our amazing neonatal care. If your baby needs the additional support that our NICU provides, your baby will be cared for by highly trained and experienced staff, including doctors, nurse practitioners, RNs, and respiratory therapists.
Our special care unit is for infants who have graduated from the NICU. These babies are usually focused on feeding and growing. Sometimes even infants that are full term may need to come to special care if they need help maintaining their blood sugar or temperatures, depending on certain risk factors that may occur during your pregnancy.
This is the entrance to our birth care suites. This driveway is designed to fit 2 cars, so if you are in labor and concerned about walking through the parking lot, please feel free to park on the side of this driveway and get inside safely. Once you are settled and comfortable with your support person moving your vehicle, please do this in case anyone else needs to do the same thing. Birth Care Suites is open 24/7, and as long as you meet criteria and your physician is okay with it, when you are in labor, you can come straight here. The most important thing is to discuss where to go with your physician around 36 to 37 weeks of pregnancy. One of the main criteria to deliver at Birth Care Suites is being 37 weeks or more pregnant, as that is when we expect baby to be fully developed and ready to be here. If you have any other questions related to being able to deliver at the Birth Care Suites, please feel free to text or call me. Similarly to LDR, everyone needs to check in at this desk. This is again for everyone's safety. The visitor policy at Birth Care Suites is the same as it is in the main hospital. This is also where you will check in for a pre-admission appointment. Patients planning to deliver at Wesley are able to meet with a labor and delivery nurse for a pre-admission appointment. You can make this appointment up to 4 weeks before your due date. During this time, you are able to fill out paperwork and have an opportunity to ask questions. This will expedite your admission process when you are in labor. If you have a scheduled induction or C-section, your doctor's office will help you schedule this appointment. This is one of our labor, delivery, and postpartum rooms. One of the perks of delivering here is that you are able to stay in the same room the whole time. As in labor and delivery, each room has its own shower and bath. There's a bed that folds out from the wall for you or your main support person to sleep. The same labor support and postpartum items are available here as in the main hospital. Some of our classes are back to being in person. If you would like to take any classes, please call Ruthie at 316-962-2290 to discuss the schedule and online or in-class options.
We hope you've enjoyed this tour and found it very helpful.
If you have any questions about this process, please shoot us a text. We look forward to chatting with you soon.
Congratulations on your pregnancy.